Welcome to our discussion on arthrokinematics. When we look at arthrokinematics, we need to look at the root of the word. So the root of the word arthro means joint, and kinematics is joint movement. This is to be distinguished from osteokinematics. This is reviewed in our previous video. So if you haven't seen the osteokinematics video, go back and review if the arthrokinematics is not making sense, because it is important to distinguish between the two so that we know exactly which one we're discussing. Now let's discuss some rules of the trade when it comes to arthrokinematics. We're going to discuss our convex on concave rule and our concave on convex rules. So the first rule is your convex on concave. In other words, when you have a structure that has a convex end, such as a humeral head, moving on a structure that has a concavity, such as a glenoid fossa, we need to apply the rule of convex concave, in which case the humeral head will roll and slide in opposite directions. So if this humeral head, if we need to elevate it, continues to roll up, then it's going to end up coming out of the socket. So it has to slide back down. So thus the roll and the slide have to be in opposite direction in order for us to keep the humeral head within the socket while still elevating our arm. Now if we take a look at our concave on convex rule, in this instance this could be the elbow or the knee. So for the elbow, the ulnar is concave and the distal end of the humerus is convex. So in this case, for elbow flexion and extension, we will have a concave on convex movement. And the roll and slide have to happen in the same direction, because I need to basically go around this structure and continue to slide with it. Let's apply some of these arthrokinematics rules that we looked at. First, we're going to begin by looking at the knee joint here. So we're going to look at knee joint flexion right here in the background. And then, so first let's identify our vex and cave surfaces. So tibia right here is going to be our concave surface. You could see that it's a concavity. And our femur right here is going to be a convex surface. You can see that it's a convexity, a protrusion, a circular structures. Now, because knee flexion and open chain will be the tibia moving on the femur, this would be a concave moving on a convex structure. Thus, we need to apply the concave on convex rule. So now let's take a look. What will be the first thing that we ask? Well, the first thing that we want to identify is the movement open chain or closed chain. And the movement is in fact open chain. In other words, we have our tibia moving on our femur. The next component we're going to identify is which bone is moving on which bone. Well, the tibia is in fact moving on the femur. If we continue, we will see, depending on the shape of the articulating bone, is this a cave on vex or a vex on cave? Well, the great news is we've already identified this. We said that the tibia is concave, thus it's a concave on convex structure. And we are correct. Now let's take a look at what are the osteokinematics. Osteokinematics, not to be mistaken with arthrokinematics. Where is the tibia, the long bone itself, moving during knee flexion? Well, as we said in our video on osteokinematics, this is where you have to make sure you go and review. The tibia is moving posterior and the tibia is moving superior, thus creating knee flexion. So once we understand that that's the case, how does this help us? Well, we know it's posterior superior. Now we know that the roll will be in the same direction as the bone. So thus, what is the direction of the bone of the roll? The direction of the roll is posterior superior. Yes, it is. So now we have to identify the direction of the slide. Well, we said that in a cave-convex joint, the rule of thumb is that roll and slide will happen in the same direction. So thus, our slide should also be posterior superior since it happens in the same direction, and it is. Now let's take a look at humeral flexion. When we're looking at humeral flexion, it's going to be our humeral head, which is convex, on our glenoid fossa, which is concave. You can see in this picture right here that the humeral head is in fact convex, and in green here you could in fact see that the glenoid fossa is concave. So let's go through our questions. The first question, if you remember, is this an open chain movement or a closed chain movement? Well, it looks like the humerus is moving on the scapula. That's distal on proximal. So it's an open chain movement. Yes, it is. Thus, the bones that are involved are humerus on scapula. And we've already identified the humerus is convex and the scapula is concave. Thus, the rule that we're going to apply is vex-on-cave. The vex-on-cave rule states that the roll and slide will be in opposite directions. So we need to find out what those directions are. We look at the osteokinematics. So if we look at the osteokinematics of the humerus, we have to ask ourselves, where is this humerus going? Well, it looks like the humerus is moving anterior to the body and superior to the body. Those are the osteokinematics, and they will lead the way to the roll. If we know that osteokinematics are anterior superior, which is in fact the case, we know that the roll will always follow the bone. Thus, if we know the roll will follow the bone, the roll will be anterior superior. So the last question that we have to ask ourselves is, what is the direction of the slide? Well, let's go back. We're applying our vex-on-cave rule, where vex-on-cave rule states roll and slide are opposite. Well, what's the opposite of anterior superior? The opposite of anterior superior is posterior, inferior. Thus, during shoulder flexion, we will have a posterior inferior slide and an anterior superior roll. I hope this video on arthrokinematics made the rolls and slide a little bit simpler. But if not, go back to the video on osteokinematics and then come back and review this video again. Hopefully, things will really come together for you.